Sir, it's sharp 5:30, so with all your due permission, can we begin?
Yes, I am ready.
All right, sir. Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, doctor, for today's session. And he is none other than Dr. K Suresh, sir. Sir is a very renowned internal medicine. Sir is MD, DIH, DF, FIAP, FIPHA, FISCD, family physician, public health consultant, Bengaluru, and visiting professor of practice, Garam, Karnataka. With the help of sir, we'll be taking a close look on today's topic, and on such a very special occasion, which is World Health Day today, we'll be celebrating management of silent stroke in elderly in smaller settings. Before moving on to today's session, let us have a brief look on what the topic says. Silent strokes occur when a clot blocks a blood vessel in the brain, but the person experiences no symptoms. The lack of symptoms in silent strokes is caused by damage to a small part of the brain that controls no essential function. We will be learning more about the topic with the help of sir and with sir's wonderful insights upon the topic. So now moving on to today's session, I would like to welcome sir at our forum. Sir, we welcome you at our forum, and now the session is all yours. You can continue from here.
Thank you, Batul. Thank you to IJCP for providing this opportunity, and to friends who have joined this site. As Batul was telling already, this is the occasion of World Health Day. We just recall about World Health Day for a minute and then link the content of today's talk to what is this particular observation of World Health Day means. Now, basically, for the current year, the title or the theme of the subject is known as Health for All. This is the past 70 years we are celebrating on every 7th April. The basic idea of celebration is to call for actions to help tackle the health challenges today and tomorrow. If we know what happens is whenever a celebrity meets with whether it is silent heart stroke or heart attack or even stroke, there is a berserk news. And then, unfortunately, the words of silent stroke and silent ischemia are getting media attention, but there is a least follow-up of interventional by either the government or the health sector specifically. Why should we talk of this? Most of these events can be prevented if we act in time. So acting in time demands the attention of a family physician, and this also is a particular group of population. Silent stroke is a problem of elderly starting from around, let's say, 50 years, but nowadays we are seeing even in younger population. What are the problems? Why do we get into this? Most of us in the developing countries feel whatever we feel. I feel fit because I am only feeling fit, not necessarily I am fit. If you talk to a doctor, I am sure every one of us will tell, sorry, I cannot certify you as a fit person unless I do certain tests. It may be physical examination, coupled with some of the blood tests, ECG, echocardiogram, cardiac or brain CT scans, sometimes even CT angio, brain or heart. Therefore, the issue here is, the challenge is to convince the group of people of 40 plus who are doing excellent, maybe running marathons, maybe exercising in gyms every day, or at least doing the routine daily work without much hassle, but very often compromising sleep, general health, particularly those who are having hypertension, diabetes, and the lipid profile bad, still keep on pushing themselves, feeling because they are healthy. So the only choice we have is to, if you want to prevent the strokes in general, silent strokes in particular, checkups are required. Maybe after the age of 60 years, once in 2 to 3 years. After 60 years, definitely an annual checkup. What does it do? But how often we as Indians, how do we feel? If you ask any even literate person, what we feel is any health checkup will throw that there is something wrong with me. The doctor will call for unnecessary procedures. Though there are conflicts of interest among some private laboratories and some imaging centers, by and large, the annual checkups are going to help to streamline the actions taken to avoid these catastrophes. Therefore, I personally feel the primary care physician, or what we call the family doctor, has a much larger role in addressing strokes in general and silent strokes in particular. Basic definition, Batul has already read you. What we need is some blood vessel which gets blocked either due to clot, or sometimes there may be hemorrhage because of the bursting of small vessels. That leads to certain signs and symptoms. This is in general for a stroke. But in the case of silent stroke, which is the key thing for today's discussion, there's hardly any noticeable symptoms. Most of them are caused by the blood clots in tiny vessels to a particular part of the brain. And since the blood supply and oxygen supply for that particular area and surrounding brain cells, they die, exhibiting subtle symptoms and signs. And these symptoms and signs depend upon the area affected. We'll come to that a little later. People also call this as mini stroke or asymptomatic cerebral infarction. In either case, the affected parts, brain cells die, manifesting a lasting brain damage, long-term disability, or sometimes even death. But silent stroke really lead to death. I will start with some basic thing because in this 56th year of my profession, one of the things which I follow is in a group discussion, start from what generally people know and enter into the areas what is maybe new to some of you, if not all. So this is the first case of an elderly lady just recently, about 6 months ago, in a town known as Hospet. Right in the midnight, she gets an fitness, fits, and becomes suddenly unconscious for about half an hour. By the time the family is able to resuscitate her, the entire family notices the left-sided hemiparesis and the speech inability, what we call as dysphagia or aphasia. If this is in case of dysphagia, there are difficulty in speaking, the words are not clear. Since it was midnight, the consultation was done only on the next day. And you can see the infarct shown here, which had led to in the areas of what is called as precentral artery area, and another one in the area between posterior and middle cerebral arteries. The ECG indicated atrial fibrillation with abnormal ITB and anterolateral ischemia in the left ventricle. A Doppler test done on the 10th of the same month did not show any abnormality, and the systolic function or ejection factor was 65%. That means heart was normal. She recovered about 20% of muscle power. Physiotherapy did help her. Today she is able to go to bathroom herself after about 8 weeks. But speech continues to be slurring. And as you know, these are smaller towns. Nowadays, speech therapies are difficult to get in these places. So therefore, this also recalls that she did have similar attack about 8 months ago, which was silent stroke. They did not recognize, but this transient stroke was known only by doing CT scan. So these types of cases, most of us clinicians or general clinicians would have faced. And what we generally do is quickly refer. So nobody would like to play with such a case. Now, this is my own autobiographic case. As you know, I am around 78 years old. I had undergone cardiac bypass surgery in June 2005, just before a year before my retirement from UN agency. And in the following year, while I was doing my routine morning walk, I suddenly lost my balance and fainted for a few minutes. In hardly 5 to 6 minutes, I got up, completed my walk, though I felt that there was some weakness in the left extremities. But very next day, things were routine, did not even bother, though I myself was a doctor and had the bypass surgery recently, all those things. I took it as a general weakness and did not bother at all. When did it come to my notice? It was only after 4 years, in 2010, we get done our annual checkups every year. And that's why, because it was just, then only a tiny infarct was noted in my right cerebellum, indicating a silent stroke about 4 or 5 years ago. That alerted me to take what we call as a managing certain conditions to avoid recurrent strokes. Recurrent silent strokes are common, are becoming more and more common nowadays. We'll come to that with some more cases. So there are 3 factors which one need to worry about. Hyperglycemia, for those known as diabetic, blood cholesterol, and hypertension. If we manage well, we live almost a normal life. For example, starting from 200,006, it's 223 now, 2023, 18 years, I've been able to manage without any disturbance all my routine work, and I keep traveling quite a lot. Therefore, the importance for the primary physician is to, once you come across such cases, help the family and the individual to manage these 3 conditions so that recurrent episodes can be minimized. The common thing which we do is always advise people to reduce their weight by 15% ideally. I was 65 kg, today I weigh around only 58 kg in a span of last so many years. By doing intermittent fasting, daily exercise, I spend about 90 minutes of walking and muscle strengthening exercises, and then the periodical checkup of HbA1c, fasting blood sugar, blood cholesterol, and exercise. As I told you, I do it at least 5 times, monitoring of the blood sugar at home to see that and adjust my diet. This is the CT scan of which was shown for me. Where was the damage here? Though I did not, as I told you, recognize myself. This is post facto after 4 years. Now I come to another case, a 60-year-old man, known diabetic and hypertensive for 5 years. Both of them are poorly managed. Most Indian senior citizens the management of these conditions, be it diabetes or hypertension or blood cholesterol, is very generally poor. This was recently on the 10th of last month. In the midnight, this gentleman calls for, he feels hungry and he eats 5 idlis in the breakfast as if it was almost 2 o'clock in the morning, though I have used breakfast. And he suddenly becomes disoriented, fell just before going to bathroom to wash his hands. On the examination, blood sugar had shot up to 410 mg per deciliter. BP was 128. When I examined him, the next day, it's not the same day, next day early morning, the muscle power on the earlier affected left side, he already had a hemiparesis for the last 2 years, was worse than what it used to be. That means in a repeat attack, worsened the muscle situation. Since the blood sugar was 410, he was given 20 units of insulin and metformin and had a lunch and dinner. It took almost 24 hours. Since he was agitated, we put him on chlorpromazine also at that night. Next day, the entire day he was drowsy. Only following day he was put on a smaller dose of chlorpromazine, 25 mg. Today, after about 36 hours, he was almost normal and is able to walk around, and the CT scan shows silent strokes in the patient. He had similar attacks in 23 twice, once on 27th February 2023. Again, at that time, blood sugar was very high. BP was also very bad. Similarly, he was recovered after heavy doses of insulin and followed up. As of December 22, he did have a stroke. At that time, it was very clear, and he had developed hemiparesis, urinary incontinence. So recurrent strokes, once you have it, unless the blood sugar, hypertension, and cholesterol are managed well, recurrent silent strokes are common. Now this is his CT scan. You can see how many areas are diffused. This is a non-contrast reading. It shows the worsening right-sided weakness and aphasia. It demonstrated diffuse hypodensity, that means low. Angio, coronary angio, you can see it shows that occlusion of left precavernous supracranial internal artery, which is this circled area. And also there is a distal middle cerebral artery, what is called as MCA, trunk attenuation. So these are the damages. But of course, this is not for the family physician to look at. But once you get the CT scan done, it is not very difficult, though the imaging guy also give you the report, you can also have a look at that. Another condition which might lead to silent stroke is called as spontaneous coronary artery dissection. Here, this is a Lamani male of 57-year-old. He was a case of COPD, having smoked 40 pack years, that means 40 cigarette packs years. It might be 20 into 2 or 15 into 3, whatever number of packs per day. The ECG had shown the lateral T wave inversion. and he had denied any ischemic symptoms, whether it is chest pain. Diabetes also ruled out based on the fasting blood sugar, and there was a blood film showed polycythemia secondary to smoking. CT scan done on the admission showed an area of low attenuation in the right cerebrum. You can see this location. And he was diagnosed clinically as left hemispheric stroke. He was initiated on antiplatelet therapy as per the local stroke protocol. ECG ruled out any embolic cause. Then echocardiogram showed an akinetic apex thrombosis, just here. Severe left ventricular systolic impairment with ejection factor of less than 35%. He was started on epivaccine, and diagnostic coronary angiogram, you can see this, showed a spontaneous coronary artery dissection in the middle segment of left artery dissect, and then it was proved to be a silent stroke. Another person with recurrent stroke, this is a 56-year-old lady. She was brought with a history of hypertension and migraine, plus headache, and her husband brought to the emergency saying that she was walking strangely in circles. Until previous evening, she was fine. When an emergency CT was done in Medical College Hospital, it shows intracerebral hemorrhage in the left frontal cortex and cerebral amyloid angiography complicated the intracranial hemorrhage. Asymptomatic ischemic stroke discovered by the MRI. Echocardiogram was found to have a mass under mitral valve, also strongly positive of antiphospholipid antibodies. She was diagnosed as non-bacterial thrombotic endocarditis, primary antiphospholipid syndrome. The treatment decision was complicated by the history of CAA and ICH. However, she was put on anticoagulation. A multidisciplinary decision was taken, and she was on warfarin trial for 3 months, but fortunately she did well and recovered over a period of 18 months. Another risk factor is sickle cell anemia in countries like India. As you know, we have 1 in 86 births among the ST population who are born with sickle cell disease. The country is having roughly about 20 million patients at any given time. Though there is a treatment recently which is helpful, but coming to the situation here, the permanent treatment is only stem cell or bone marrow transplantations. Now, this is a report of 30-year-old tribal woman in Orissa. As a UN officer, I used to travel the entire country. This is one of those visits I found. This lady was brought with headache and repeated vomiting and inability to balance herself. Therefore, they are going round and round in a crazy cycle. An MRI revealed a large volume silent stroke. She recovered within a week following they went back home based on the treatment of antiplatelet, etc. 2 months later, he reported again with a transient arm weakness. I was there at the second time, a second large volume stroke that manifested only in a small paresis. So therefore, the MRIs suggest that the stenosis of large intracranial vessels, possibly related to vascular injury, promoted the endothelial adhesions of reticulocytes and inflammatory elements, is involved in large volume pain infarct. So with these half a dozen cases, we would like to now summarize what are the causes of strokes, silent stroke. First, as we know, this is basically an ischemic stroke as a result of clot. Although a transient ischemic attack may mimic, but there the blockage is only temporary. If you compare that to hemorrhagic stroke, which results from the damage due to leaking of the blood into the brain and causing pressure buildup, atrial fibrillation is the commonest cause because it causes irregular heartbeat in people over 65 years, is basically linked to strokes in India. The atrial fibrillation condition increases the risk of silent stroke by double. The key factors predisposing to silent stroke are high blood pressure, hyperglycemia or diabetes, and blood levels of homocysteine or in general cholesterol. Common signs and symptoms which needs a keen observation by both the family and the family doctor. For example, the common thing is they start issues with cognitive skills and ability. It could be passed off as an aging pattern also. So people don't remember, forget, but this also happens in the routine aging process. So how do you doubt that? Then there is a temporary loss of muscle movement, particularly this is where the urinary bladder control goes. So that should make us to suspect once the people are not able to control the urine, then there's a reason to suspect. Sudden lack of balancing. This again is contradiction because we know after the age of 60, most of us start finding it difficult to balance. There are two simple tests we do. Stand on one leg. Not many of us can stand on one leg for more than 30 seconds. As the age advances, this position becomes difficult. Second is walking on a straight line, step by step, very close to each other, not giving a back. If you can walk for 20 meters, your balancing is fine. So again, sudden lack of balancing, as it had happened in my case, if you can recall, then there is a rapid change in personality or the mood. Person either suddenly becomes depressed or suddenly becomes violent, which he or she would have not been known to do. There may be problems in the speech. Sometimes there could be loss of vision and sensation. As I told you, in the case of Chidambar, he had all these problems. Muscle weakness was there, sensations were lost, knee jerk was not there, and brief fainting is maybe the only thing which makes us not even to recollect that we had such an episode. There are about half a dozen 5 risk factors. One is the family history. The chances of strokes, if you ask people who are there, they would report that some relative in the family also experienced this. Age, beyond the age of 55 years, the chances are doubling, and around 80 years or onwards, it's much worse. Strokes are higher in women than in men, and every year more women die because of a stroke than men. Previous history, that's why we called off recurrent stroke. Once you get one stroke, repeated strokes are very common. Lifestyle factor, we already talked of obesity, sedentary lifestyle, and smoking, which increase the risk of hypertension, diabetes, and blood cholesterol levels. We all know silent stroke are due to the blood clot. In terms of the magnitude of the problem, 10% of the middle-aged people with no apparent signs of stroke have been showing, the CT scans have shown to have the silent stroke. And if people are over 80 years, if we do a community level screening, 1/4 of them would have had some signs of stroke. The symptoms, as we already discussed, depends upon the area which is affected. And the damage, whatever happens, is always permanent. Now, how do you doubt as a practicing physician or a clinician? As we already told, there is no obvious symptoms and signs, but there are these 5 signs one need to keenly observe yourself and ask the family member if there are any problems. Try to distinguish between whether it is due to aging or it is something unnatural like difficulty in balancing. We talk people falling without tripping. As I told you, this case of Chidambar, on those days he used to fall at least 2-3 times every day on a plain surface without tripping or any other thing. Then difficulty with the bladder control, mood changes, reduced ability to think of anything, remembering taking their own tablets and all that. And we all know even the doctors cannot clinically diagnose. The only answer we have for diagnosis is doing a CT scan or an MRI, which will indicate white spots, scarred tissues if it is longer duration, tiny areas of bleeding vessels if it is due to hemorrhagic, and signs of silent stroke are usually very subtle. Now, what are the treatment approaches? Once you recognize, as we already told, people may not seek any treatment because they don't even know that there is a problem. So only when you discover by a CT scan and for some other problems, you may come to know.
So are you there? Hello. Sir is facing some connectivity issue. He'll just join us back. Hello, sir. Can you hear me? Hello. Sir, you are using your mobile phone. From there, you're not audible. You have joined from your laptop as well. What I can see from laptop, if you talk. No, sir, you're not audible. Not audible. Sir, you're not audible yet. Hello. No, sir, you're not audible. I can't hear you. Audible. Hello. I am audible to you, but you are not audible to me from any of your devices. And unless you connect with your device, I won't be able to hear you out. I can't hear you at all, sir. Hello. Sir, am I audible to you? Hello. 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 Sir, can you hear me? Hello. Hello. Hello, sir. Am I audible? Hello.
Hello? Hello?
Yes, sir. Now you're audible.
Now I'm using my mobile.
Hmm.
I cannot make the slide presentation. So can you post from there?
Yes, sir. Kindly share your PPT with me. I am posting it.
Post it, start from wherever we had left because I am unable to start. There is some problem with the desktop.
Yes, sir. Share me your PPT, sir.
I did share it to Nishita, no, already?
Okay. Wait. Just give me a minute. Sir, can you see my screen?
Yes, I can.
Okay. So we had left in treatment.
Yes, at the treatment level.
Yeah.
Yes. Okay. Okay, now you can go back to the treatment slide.
I'm just moving back. Just let me know where to stop.
Yes. Sorry, friends. Usual internet problem. This is our country where we can get up into problem anytime. Now, treatment, basically, I told you at your level is for management of those three risk factors: diabetes, hypertension, and cholesterol level. That's why the periodical checkups and maintaining them becomes very critical. Next, please. Next slide. Now I am walking you through some basics of strokes in general. It's not necessarily only silent stroke. So there are types of strokes which we generally called whenever we talk of stroke, what comes to our mind is a person with changes, hemiparesis, or a face which is turned towards one side. So these are general stroke symptoms, and silent stroke we already talked of. Next slide, please. Now, these are the commonly observed symptoms in any stroke. Basically, as I was telling you, the face is dropped to one side. Arms and legs, there may be inability to lift, basically indicating the loss of muscle power. And then speech is always difficult, slurred speech. Most important will be changes in the mood. Now, when you have the stroke, people are either depressed or they are very aggressive. And forgetfulness. So that is why I was telling it is always difficult to distinguish between these things, whether it is due to the advanced age or the disease itself. So one has to be careful in comparing the normal situation and try to see whether you can distinguish these factors. And commonest thing which I have seen is losing balance and falling more frequently, even without tripping. That the basic indication is person doesn't have to trip. Usually when you fall, you have to trip, or there is some reason, either slippery or tripping. Here, the person falls without any reasons which one can say why the person fell. Then this is more often falling, and there is a temporary loss of muscle power, which I had told might go to the fact that okay. Are we back now? Then there is, hello?
Sir, you're audible, sir.
I'm audible?
Yes, sir.
I think both are there. I go out of my while I control the slide from my end.
Okay, sir.
Okay. See,
Sir, will you be sharing the slides or should I share the slides?
no, now again I had come on desktop, but suddenly I'm seeing nothing is there.
Let me know, sir, if you want to let me share the slides and I'll be doing it from my end.
Okay, check. So you share the slide, I can see it anyway.
You're back to your laptop, right, sir?
Huh?
You're back to your laptop, right?
Yes, I'm on my desktop.
So do you want to share it from your end?
Let me see if I can.
Yeah, sure.
I think you better continue sharing. I am unable to log in.
All right, sir, I'm doing it.
Okay. Next, please. Next slide. So the other strokes which we also talk of is mini stroke, where there is a temporary ischemic attack. As I told you, this may be only for a short while and person does not know even what happened. Most often in mini stroke, there is dysphagia only for a short while and one-sided facial droop. There are vision changes, confusion, and passing out of urine or stool wherever the person is. Most often, again, the strokes are found only when MRI or scanning is done. Ischemic stroke is the most dangerous one because there is an active blinding, bleeding, which characterized by weakness in arms, legs, speech, difficulties, trouble in walking, blindness in one eye, depending upon the area where the bleeding is occurred, we exhibit signs and symptoms. So hemorrhagic stroke is the worst, I told you. Next, please. Now, the community approach nowadays, what we are trying to do is to study any such thing. A minimum of 1,000 people are followed, basically looking at the clinical data, physical examination, laboratory testing, MRIs, and cognitive testings over a period of 3 years. What we have seen is, first outcome is basically silent brain infarct and other silent lesion in the first year. When you do the follow-up on the first, second year, you see repeat strokes, sometimes cardiovascular events, and there is a cognitive decline. After 3 years, the clinical data collection is going on in the country, and then outcomes expected are, apart from cognitive decline and silent brain infarct, cardiovascular events are also being seen. Next. Next slide, please. So this is the magnitude of the problem. Worldwide, there are 20 million people suffer every year. In India, 1.5 million people suffer. That means every day about 3,000 to 4,000 Indians suffer from stroke. And 1 in 4 of these strokes are usually silent strokes. Next, please. Next slide. So the recurrent strokes, as we were telling, there is a study done. Out of 165 patients having ischemic stroke, only 65 were of the first episode and 100 had the recurrent of it. You can see more than half are totally repeat or recurrent strokes. Among the first stroke, about 35%, here the association of anemia was found. Wherever there is anemia, the recurrent strokes are more common. Given the anemic standard in India, we have got a lot of association between anemia and recurrent strokes. In another study, where there were 71 recurrent strokes occurred in the first year follow-up and 202 in the next 5 years out of the 1,000 cases. I was showing you how the community studies are done. So the overall rate of recurrent strokes in the first year is about 6% and about 22.5% over a period of 5 years. Those who had stroke are likely to have a recurrent stroke. Now here, though the stroke people recover either fully or reasonably well, life expectancy after stroke incident goes on decreasing. Our Indian researchers have found that life expectancy in the stroke patient on an average declines by 9.5 years. Helplessness of repeated falls, poor control over urine and stool passing, episodes of vomiting deserve more attention by the general physicians and investigation by MRI. The prevalence of silent brain infarct has this among about 1,000 people in a study has shown that 20% of them will have recurrent. Next. treatment strategies for general, this is not for silent, this is general follow-up, is called as follow-up the 5 P's. That is, what can we do with the parenchyma of the brain? What can you do the arterial flow, or also shortly known as pipe, and how do you do perfusion? Penumbra is the ischemic milieu around the actual dead cell and prevention of complications. Now, treatment with the advent of thrombolysis, things have increased, better chances have gone up. And endovascular thrombectomy is the most recent trial being done, which has shown that out of 178 patients assigned to thrombectomy and a similar number of 174 for medical care group, there was 20% improvement in thrombectomy immediately and 7% in the medical group, which is called improvement is evaluated as functional independence, when the person can become independent after the management. Among patients in large ischemic stroke, endovascular thrombectomy resulted in better functional outcomes and medical care. Thrombectomy is still in a trial stage. It is not there in India. Therefore, for us, it is only an academic interest. Basically, what we do is medical management. Next. Next, please. Next slide. So in the parenchyma, what we do is here, generally our parenchymal tissue receives about 60 ml to 70 ml of perfusion per 100 grams of brain tissue. But when there is stroke, that goes down by less than 1/3, about 25 ml. Now here, there are 3 issues which are called as lacunar stroke, thrombotic occlusion, or brainstem stroke that results into typical signs and symptoms. Next. Now here, these are the areas which is shown, if which artery is affected, what are all the possible symptoms. For example, if it is a middle cerebral artery, there will be aphasia, weakness of the arms, loss of lateral visual fields. If it is an anterior cerebral artery, this is weakness of leg because medial parietal lobe is affected. If posterior artery syndromes includes vertigo, nystagmus, hemiparesis, and hemisensory loss. Lacunar syndrome, which is basically due to resulting in aphasia, pure motor stroke, that means there is lot of muscle weakness, or pure sensory stroke. Next. Next slide, please. Now, based on the results we already told, intravenous thrombolysis and intra-arterial thrombosis have been tried. They are still in a trial stage. We will not go into details on this. Next, please. Next slide. So basically, the arteries and veins, what have been tried is fibrinolytic snake venons have been tried with success, and the symptoms, this has to be done within 3 hours of the attack. But again, availability of snake venom within 3 hours in our country situation is very rare. Basically, our management depends upon aspirin and heparin. The eligibility criteria is all of these conditions have been managed in the first 3 hours. Therefore, a stroke patient need to reach within 3 hours for a better result. Next, please. Next slide. The perfusion is to salvage the brain, and the risk from ischemia often focused on increasing collateral flow. Here, due to the loss of autoregulation, brain perfusion is strongly affected by changes in the systemic blood pressure. Hypotension and dehydration should be avoided. Therefore, what we say is in perfusion and penumbra is the area surrounding the actual damage done area. Therefore, we need to maintain these things, but first thing is maintaining normoglycemia becomes very important. Whenever you find suspect, see that the blood sugar levels are maintained well. If there is any infection, treat the fever, and then hyperglycemia is also not to be over. Hyperbaric oxygen therapy again is beyond the control of the general practitioner. Next slide. So these are the intervention depending upon what needs to be done. Again, what we need to do before the hospital goes is avoid aspirational pneumonia, putting the patient on one side so that observe for the pain. And once they recover from silent stroke, which is, as I told you, within half an hour to 2 hours, they may come back. We need to look at early mobilization and minimize urinary tract infections. And also constipation may be a possible thing, so we need to see that constipation doesn't happen. Next. General physicians come into role for after stroke special care plan. Basically, it involves physical therapy, that is muscles which are lost power slowly trying to regain power. Occupational therapy so that the person can get those skills for day-to-day routine activities at least. Speech therapy, again, in the smaller town, it may become difficult. So therefore, because this condition occur in senior citizens, confusion is always possible, but keen observation will help us to identify and help to the extent possible. Next. So time and again, I keep saying, avoid the second stroke by stop smoking. Consumption of medicines if people are there for blood pressure, cholesterol, diabetes regularly, and dietary pattern, basically vegetarian pattern to minimize poly unsaturated sources of fat should be used. That means instead of saturated fat like ghee, etc., in simple terms, anything which becomes solid at room temperature is a saturated fat we need to avoid. Next, please. Healthy habits to minimize silent stroke. We already talked of control of blood pressure, serum cholesterol level by LDLs particularly, monitoring blood sugar and HbA1c, quitting smoking, cutting back saturated fats, eating a healthy diet which includes fresh fruits, veggies, and whole grains, and of course, get a regular exercise and keep healthy weight. Next. So this is summary, basically ischemic stroke, managing 5 P's, primary care physician role in recognizing and rehabilitative level is very important, monitoring blood sugar, hypertension and blood cholesterol and advising accordingly. Next. Silent stroke can be diagnosed only by CT scan or MRI. Basically, they are asymptomatic. Need to be observant about those 4 or 5 conditions which are scaled. Therefore, what need to alert is sudden lack of balance, temporary loss of basic muscle movements, slight memory loss, and sudden changes in mood or personality, and issues with cognitive skill and ability of the person over the 50 years. Either talking directly to the patient or to the family member should help the general physician or the family doctor to suspect and refer for CT scan. Rehabilitation is required for all of them, family sympathies. Next. So these are some basic references. Next. Thank you. What I am saying is a primary physician can identify, refer, or treat to a certain extent and prevent recurrent strokes. do whatever you can to the best of your ability and improve the patient's quality of life. Because once there is damage done, as I told you, there is a permanent thing. Thank you for the patient hearing. Sorry for this internet interruptions.
Thank you so much, sir, for such wonderful insight upon the topic that you have shared in. We have received few questions and I would like to put it across to you. The
Go
first
ahead.
question, we have received few questions and the first question is, what are the risk factors for silent stroke in elderly?
As I told you, the risk factors are basically uncontrolled hypertension, uncontrolled cholesterol levels, and uncontrolled blood sugar level. The three are key, and the confusion there is to distinguish between, this is for the doctor to think whether it is normal for the age or it is due to silent stroke.
Thank you so much, sir, for answering this question. We'll move to the next question that we have received. And the question is, what risk factors are more common in patients experiencing small vessel occlusion stroke?
Again, it is same repetition is in the Indian studies indicate that hypertension is the first culprit. Second culprit is the blood cholesterol level. And third, of course, is uncontrolled blood sugar levels.
Thank you, sir, for answering this question. We'll move to the next question and the last question for today's session. And the question is, which is the most common type of stroke in older people occurs when the flow of blood to the brain is blocked?
The commonest is what we call as ischemic. 80% of our cases are due to ischemic strokes. Only 20% are due to hemorrhagic stroke.
Thank you, sir, for answering all the questions. That was the last question for today's session. And at the outset, I would also like to thank all the viewers who have joined our platform and who had stayed tuned with us throughout the session. I would also like to thank you,
and
sir.
sorry for this interruption.
No, it's absolutely fine, sir. It's absolutely fine.
Thank
so
you.
With all your last conclusions, sir, we can conclude the session here for today.
Thank you.